I don't consider myself an artist, I consider myself a craftsman. I started here at Wheaton Arts in 1979. I work mostly with stoneware and porcelain clays, and I make functional pottery. I always wanted to make pots that people would use. I can see what I've created every day, and it's an infinite number of shapes and designs, the kind of pottery you can make. And I just love the act of making pots on the potter's wheel. You know, you get really used to that being your living. I always tell people pottery isn't something I do, it's who I am. My name's Terry Plasket. I'm the resident potter here at Wheaton Arts. I've been here for 45 years. I started smoking when I was in college. I felt that it would help me stay awake all night when I was studying for exams. And I smoked on and off for a little while out of school, and then I became a steady smoker. So I smoked for the better part of 35 years. And I felt that I reached this level of achievement that I can actually start refining the work that I want to do, and I didn't want to die. I had tried other ways of quitting. I tried, pharmaceuticals, I tried hypnotism, and nothing ever stuck. And then when I found out about the Inspira Health hospital program, it seemed like they're a hospital. They should really know what they're doing. So I signed up for that, and that helped me quit. It was really amazing. And I went, and over the course of 6 weeks, I managed to quit smoking. And I mean, it takes a lot of practice to learn how to make pottery. It takes a lot of commitment and practice to learn how to quit smoking as well. And just like making pottery, you don't learn it alone. You need someone to help you. And that's the way it was with the Inspira Quit Center. Today, I'm having a couple of the counselors from the Quit Center that helped me to quit smoking come, as well as Amy, the CEO of Inspira. And I'm gonna have them sit down on the wheel and make a pot.
Wow, look at this place. It's so exciting. Hello, Terry, we're here.
Hey guys, come on down.
I got your fan club with me.
Marietta, you're over at this wheel. Amy, you're in the middle.
Okay.
Tiffany, you're over at this wheel. So what I want you to do first is put your foot on the pedal and just try it. Just have an idea what the response is gonna be. So keep your hands wet at all times. It's gonna be a long day.
Yes.
I said a half hour, maybe. Remember the thing I said about put your hands on easy and take them off easy?
Oh yeah, that's what I'm doing
You forgot
wrong.
that part, yeah.
I did. That's what it is. Okay, I'll do it better.
I'll be getting more clay for you in a minute. All right, Amy, it's not a cat. You're petting it.
But I'm good at that.
She's petting this cat. I mean, no. Where else can you yell at a CEO like this? You know what I mean? This is awesome.
Terry, what made you come in the first time?
I had wanted to quit because I had tried other things, but this was so structured, but informally structured, if that makes sense. You know, the atmosphere was informal.
We're lucky to work closely with Rutgers and the Tobacco Studies Institute up there, who provides us with that information, and they're always updating everything they do. They're researching constantly.
Our program is 100% free. It is free to call, it is free to do an assessment, and it is free to receive 6 weeks of the nicotine replacement products, which is the patch, gum, and lozenge. They are proven to be effective to help you quit.
When we were talking, you were talking about how the pottery gave you someplace to go or to focus on. Maybe you could just give me a little bit there about what that felt like when you were going through your quit.
Well, I mean, I think the comment I made was like, when you smoke and you're doing something, you always have to stop and go smoke. And I don't think it just applies to pottery, but a lot of things that you do, you get into a rhythm of what you're doing, and if you keep breaking that up, it breaks your work up.
Right.
You know what I mean? And it made a big difference. I couldn't believe it when I quit smoking. Also, how many more pots I got made, because I didn't keep stopping. You know? I have to thank you guys for the program, and I recommend this program to everyone if you want to quit smoking. I really do. For me, I think one of the changing things about this program, as opposed to other things I tried, was the accountability. I had accountability to you too. When I came in, you were going to ask me how much I smoked, and also the positive reinforcement that you gave back to me.
We can provide services, and Inspira is wonderful. We have the opportunity to do that there. We supply the patches, the gum, the lozenges, the counseling, but the work that you did too is so important. It's not like we sprinkle you with fairy dust and you just quit with those things. You also have to work hard, and you did that.
It's the long-term health benefit.
Yeah.
Sometimes it's hard to see on the outside, but it's, you know, as you said to me, you're a family and want to be able to see your children, your grandchildren grow up, and, you know, it's all part of the process.
And you can live forever, but what is your quality of life like? You
Right.
know, do you have a tank, you know, that you're walking around with? Can you go up and down your steps? You have the grandkids, but what can you do with your grandkids?
I want to keep doing this. I mean, I'm 72. I want to do this for another 20 years. And if I was smoking, I wasn't going to quit. And I have a wonderful wife, and I have 4 beautiful grandchildren, you know, and I want to be able to teach them some of this and be around for a while. It's been 5 years now without smoking for me, and I'm done.